6 more deaths in aged care. When did they get infected?
I don't have that data.
Okay. Do you know if they died with the virus or from the virus?
I'm not the coroner, nor am I a doctor, so I wouldn't make that judgment. I've not sought to make that judgment at any point.
So why are people in aged care still getting infected?
Well, because this is a wildly infectious virus, and people in aged care are, whilst aged care is their home, aged care is not where the staff live. The staff live in the local community, and we have community transmission, and therefore the virus can spread. Sorry?
So it's still from the staff?
Well, it can be from many different sources, but it stands to reason. If somebody has not left a particular facility, but there are different people moving in and out of that facility, and that there's no alternative other than to provide no care, or have a situation where staff live in, which is many tens of thousands of people. I'm not quite sure where we put them.
So
then there is
that's still causing the transmission in aged care right now.
Well, I wouldn't make a blanket statement like that. I don't think that statement could be read to mean all cases and all aged care. What I'm saying to you is that logic tells you that if you've got it in the community and you've got people by necessity moving from the community into these settings, that is a risk. The other issue too here is that not all of those who are connected, and that's the reporting we do every day, those deaths are linked to an aged care outbreak. Whether that person has in fact passed away as a resident in an aged care facility as opposed to a hospital, I haven't got that detail.
Is the aged care regulator doing its job? Only 13% of the centres that have had an outbreak in Victoria have been visited since they've had an outbreak by the regulator. Is that of concern to you?
Well, Rich, I'll put it to you this way. To the extent that I have concerns, I'll have a discussion with the federal government rather than necessarily speaking about those matters at a press conference. We are having a Royal Commission into this sector, and I think we're having it for a very, very good reason. Our focus is not so much on trying to emulate that process. Our focus is on trying to keep people safe, and the number of active cases, the number of outbreaks, the extraordinary measures that we've gone to step into a system that we have absolutely nothing to do with, I think should give everyone confidence that people have put aside differences, people have put aside, lines that have one system run by the Commonwealth and another system run by us. That's not the concern. The focus is trying to do everything we can to make these environments as safe as we can. But it's a joint and a shared thing. It's not. It is not a sector that's run by us. Despite that fact, we've had 5,000 shifts in those settings that have been undertaken by hospital staff, and I want to take this opportunity to thank them. And I can't say that there won't be many hundreds more. We're certainly working to try and avoid that.
Three of the 10 cases today you said were linked to complex cases. What are those cases?
The show release, I think, will deal with that.
7 under investigation, a bit of a worry. I know it's early, but we haven't had that.
No, I think. Well, again, we have. That is a higher number than it has been, but I wouldn't read anything into that. We may be able to close those out quite soon, or not. That's something that we simply have to wait for the passage of time and the work that the detectives are doing. That's why, for instance, the fact that 80% of interviews are being conducted within 4 hours, and that's not just today. That's been happening for quite some time. That's at least my advice. I'm very pleased about that. Not using the whole 24 hours, indeed, just a portion of it. And making sure that we're on to close contacts and on to everybody as quickly as possible, that's a really important thing.